Welcome back to the show, Ins and Outs of Medical Imaging. I'm your host, Natalie Henning. This is a production of Creative Communications from Jordan High School in Jordan, Minnesota. In today's episode, I'll be breaking down another very popular way to detect injury, disease, and more. Again, in this episode, I'll be breaking down the background, why, how, when, and what to expect when getting a CT with and without contrast. Did you know CT is the most popular way to get images of a body in an emergency situation? Before we break down what CT is, we should understand what CT stands for. It stands for Computed Tomography. According to Catalina Images, the invention of CT was in 1971 by a man named Godfrey Hounsfield. Let's get into what CT is. CT uses X-ray technology to get images. Then a computer is used to make the images of bones, blood vessels, and soft tissue in the body. Now I'm going to be breaking down what the printed scans look like for what doctors look at. The following information is from Mayo Clinic, a medical treatment center. There's a narrow X-ray beam that rotates around the patient's body that creates two-dimensional images. These images are like slices of the body or organs. When they get stacked on top of each other, they create a 3D image. Much like when you cut down a tree, you can see the rings from how old the tree is. Now I'm going to be talking about when and why doctors might request a CT. Mayo Clinic states that there are many different reasons doctors might request CT scans. Some of the reasons being to diagnose muscle and bone conditions, as in tumors, to guide procedures like surgery and biopsies, to find and watch disease, cancer, and masses, and internal bleeding from trauma. Sometimes there might be a need for an iodine-based contrast. This contrast shows up bright on the images so the doctors can see a clear image of what they're looking at. This dye makes blood vessels, organs, and tissues more enhanced and more visible to see abnormalities. There are a few ways that contrast can be given to a patient: by mouth and injection. First, I'm going to be talking about how a patient can get contrast by mouth. There's a liquid that can be swallowed to show the esophagus and the stomach. This liquid is described as salty, bitter, and metallic tasting. When drinking the contrast liquid, you might feel bloated or a tight tension in your abdomen area. The other way contrast will be given is by injection. A contrast agent that can be given like a shot or injected into your IV system to show veins, arteries, and organs. When the contrast is injected into your IV system, you might feel a warm, tingly sensation. You also might feel like you urinated, but it's just the sensation of the contrast. Now I'm going to be explaining what to expect when you receive a CT scan. When receiving a CT scan, you might get strapped down slightly to a table just to ensure that you're holding still so the images are clear and can be examined by your doctor. The donut-shaped machine will move around your body in a circular motion for about 20 minutes. This information is found on Anderson Cancer Center, a website that specializes in cancer treatment and research. Now I'm going to be talking about the risks of radiation. The risks from radiation is something many people worry about. Though there are no recommendations for the limit of CT scans, every encounterment of radiation can increase the chance of cancer. Cancer from radiation is caused when the nucleus of the DNA is damaged. This information is from the National Institutes of Health. How has CT impacted the medical field? Let's get into it. The following information is from Johns Hopkins Medicine, a healthcare and education institution. CT has a big role in working with trauma patients. This is because the images are developed faster. CT has resulted in better surgery outcomes. This is because doctors are able to plan more precisely and stay away from complications. Now I'm going to be talking about how CT scans will look like in the future. According to Nature.com, the time it will take to receive a CT scan will reduce to just minutes. Radiation exposure will also be reduced. CT scanning machines will also become more portable. Make sure to follow along if you are interested in having a career in the medical field, or if you would like to know more about medical imaging. Thanks for watching Ins and Outs in Medical Imaging. I'm Natalie Henning. Please like, follow, and share on YouTube at JHS Creative Communications. See you next time.